Patients, I think the formula is just treat them as if they were your family member. I think that's the big thing. If somebody comes in, you say, hey, I'm going to treat them as if they were my family member, they can sense that. Right off the bat, their guard goes down and they trust you. I think as I was growing up and I was in college and you ask yourself, well, what am I going to do with my life? You know, I had to look back and I thought, well, what are the things that I like to do? One, I like to be a forever student, forever student and always learning. But at the same time, I do enjoy the altruism. I feel good whenever I can help somebody, right? And so I really enjoy that aspect of physiatry, that I focus on the quality of life for my patients, right? So in the clinic, for example, I deal with a lot of patients that have musculoskeletal and spine pain. And so even though it's not cancer or anything that's life-threatening, it is something that debilitates people and it decreases their quality of life. And for me to be able to do something about that and to give quality of life back to these patients, I think that was a huge, huge pull for me and why I did physiatry. You can tell when somebody is in a lot of pain, they come in, they can't move their shoulder, they're grimacing, they can barely move it. We do the injection or the therapy and the medications, etc. They come back and they're smiling and completely different person, a complete 180. So yeah, so not only is the physical exam different, you can tell from the moment that you walk into that room and say, oh, this person is better. Whether it's something as simple as like physical therapy and just to strengthen the muscles, but if you need a little bit more help than that, you don't always need surgery, right? People think, oh, I have knee pain, I need to have surgery. Not necessarily. Sometimes it's as simple as physical therapy or a simple injection that can get you back up and running. I think another part that's really, really important is just education, right? Sometimes I don't do anything in terms of treatment, but just by explaining what they have, they've told me like, hey, I feel better just knowing my diagnosis, knowing my prognosis, right? It's important to keep the mind strong, but you got to keep the body strong too. I feel a lot of times we go one way or the other. So when we're not seeing patients and we need to move our bodies, we set up a pull-up bar. It's pretty funny. It's actually in the staff closet. But you can open it and the pull-up bar is right there. And so we're like, all right, we just saw a patient. We got let's do 10 pull-ups. If your desire is just to be able to help somebody, no compensation or anything, just in it that you're in it because they feel better, that's number one. Number two, I would say the ability to always want to learn, because there's always new research, there's always new treatments. And then three, treat everybody as if they were your family member. And I think with those three ingredients, I think you're on your way to be a good doctor.